Knievel.
The Senate will please come to order. Please join me in a moment of silence today in lieu of a devotional. Thank you. Are there any announcements? The senator from Chittenden is recognized.
Thank you, Madam President. Pending entry on the calendar for notice, I move the rules be suspended and S24, an act relating to banning flavored tobacco products and e-liquids, be referred to the Committee on Economic Development, Housing, and General Affairs with a report of the Committee on Health and Welfare intact. Thank you, Madam President.
Thank you, Senator. The senator from Chittenden has moved that S24, which has been on the calendar for notice, that the rules be suspended and that it be moved to the Committee on Economic Development, Housing, and General Affairs with the report of the Committee on Health and Welfare. Are you ready for the question? If so, please unmute. All those in favor, please signify by saying aye.
Aye.
Those opposed, nay. The ayes have it, and you suspended the rules. Not only have you suspended the rules, but you've also, excuse me, I need. Thank you for your patience. You have not only suspended the rules, but you have referred to the Committee on Economic Development, Housing, and General Affairs with the report of the Committee on Health and Welfare intact, S24. Thank you. We have referrals under Rule 31 this morning. First, Senate Bill S33 being on the calendar for notice affecting the revenues of the state under Rule 31 is referred to the Committee on Finance. Also, Senate Bill S51 being on the calendar for notice and affecting the expenditures of the state under Rule 31 is referred to the Committee on Appropriations. Senate Bill S62 being on the calendar for notice and affecting the expenditures of the state under Rule 31 is referred to the Committee on Appropriations. And finally, Senate Bill S109 being on the calendar for notice affecting the expenditures of the state under Rule 31 is referred to the Committee on Appropriations. This morning we have two Senate bills for introduction. First, S121, an act relating to plug-in electric vehicle registration fees introduced by Senator McDonald. Please listen to the first reading.
S121, an act relating to plug-in electric vehicle registration fees.
You've heard the first reading, and the bill is referred to the Committee on Transportation. Also, S122, an act relating to the required votes of presidential electors, introduced by Senator Pearson. Please listen to the first reading.
S122, an act relating to the required votes of presidential electors.
You've heard the first reading, and the bill is referred to the Committee on Government Operations. We have 6 House bills for reference. H108, an act relating to Vermont standards for issuing a Clean Water Act Section 401 certification, introduced in the House on January 21st, 2021. Please listen to the first reading.
H108, an act relating to Vermont standards for issuing a Clean Water Act Section 401 certification.
You've heard the first reading, and the bill is referred to the Committee on Natural Resources and Energy. H127, an act relating to approval of amendments to the Charter of the Town of Barry, introduced in the House on January 26, 2021. Please listen to the first reading.
H127, an act relating to approval of amendments to the Charter of the Town of Barry.
You've heard the first reading, and the bill is referred to the Committee on Government Operations. H128, an act relating to limiting criminal defenses based on victim identity, introduced in the House on January 26, 2021. Please listen to the first reading.
H128, an act relating to limiting criminal defenses based on victim identity.
You've heard the first reading, and the bill is referred to the Committee on Judiciary. H177, an act relating to approval of an amendment to the Charter of the City of Montpelier, introduced in the House on February 3rd, 2021. Please listen to the first reading.
H177, an act relating to approval of an amendment to the Charter of the City of Montpelier.
You've heard the first reading, and the bill is referred to the Committee on Government Operations. And finally, H195, an act relating to use of facial recognition technology by law enforcement in cases involving sexual exploitation of children, introduced in the House on February 5th, 2021. Please listen to the first reading.
H195, an act relating to use of facial recognition technology by law enforcement in cases involving sexual exploitation of children.
You've heard the first reading. The bill is referred to the Committee on Judiciary. And further, H289, an act relating to professions and occupations regulated by the Office of Professional Regulation, introduced in the House on February 18th, 2021. Please listen to the first reading.
H289, an act relating to professions and occupations regulated by the Office of Professional Regulation.
You've heard the first reading, and the bill is referred to the Committee on Government Operations. This brings us to the orders of the day. We have on the calendar for action S117, a committee bill related to extending healthcare regulatory flexibility during and after the COVID-19 pandemic, and to coverage of healthcare services delivered by audio-only telephone, which was introduced on March 10th, 2021. Please listen to the second reading of the bill.
S117, an act relating to extending healthcare regulatory flexibility during and after the COVID-19 pandemic and to coverage of healthcare services delivered by audio-only telephone.
The senator from Chittenden District, Senator Lyons, is recognized for an explanation of the bill.
Thank you, Madam President. I will explain the bill, but also would ask that I could explain the short amendment after explaining the bill. Thank you.
Without objection, you may, Senator. Thank you.
All right, thank you. As you all know, we have worked since last year at this time. We all went, some of us on audio only. Our committees worked by telephone. And then shortly thereafter, we began our work on Zoom, and we've been doing that since. This bill is an update to two bills that we passed, one Act 91 and the other Act 40. So as we go through the bill, and as you look through the bill, you'll see some sections that may not follow one another. So the bill that you have before us, before you from the Committee on Health and Welfare is an amendment to the two acts that we have previously passed last spring and then early in the fall. The bill is an extension of provisions that will provide for safety, for increased and improved workforce in the healthcare facilities and industry, for access to care by patients, and for the operations of facilities during a very difficult time. So as I said before, some of the sections in the bill are not sequential and the numbering is difficult. It is a ledge council issue. And as you go through the bill, if you have questions, it will be helpful to identify page numbers so that we can communicate effectively. As I go through the bill, I'd like to point out some of the important areas that we have had in place and now that we're going to continue to have in place to protect Vermonters and protect our frontline workers during the COVID experience. Currently, there are deadlines of March 31st, 2021 for many or all of the sections that are in the bill. And what this bill does is to extend the deadline for each of these until March 31st, 2022. So overall, it's an extension of provisions that we had passed previously in Act 91 and Act 140. There are new sections in the bill related to audio-only patient visits with their practitioners, and that section, we'll go through that section as well. So in the sections 1 through 3 of the bill are, as I said, extensions of related flexibility provisions that originated as a result of COVID. Within these sections, we see that at the Agency of Human Services can modify existing rules or adopt emergency rules to protect access to services for patients. Protections for employees of healthcare facilities will continue to be under the Department of Health guidelines and regulations. So those healthcare facilities include hospitals, long-term care facilities, and so on. So the social distancing, the mask wearing, the cleanliness that we've seen, to the extent needed, will be continued and be under the guidelines of the Department of Health. Also included is the authority for the Agency of Human Services to waive or allow variances from rules and standards governing providers of health care and human services. So this is a broad range of facilities that are covered here: adult day, hospitals, nursing homes, child care facilities, and so on, that allow for effective running of these organizations during COVID. There are also flexibility in provider credentialing for Medicaid, flexibility in provider credentialing requirements to the extent permitted under federal law, so that we can see an increase in needed workforce. There's also a section that allows for the early refills of maintenance medications, as people are still concerned about COVID and may not be willing to go out to get their medications. The pharmacy will now allow for early refills. Buprenorphine prescription renewals will continue to be available without an office visit until March of 2022. And then there's authority for the Agency of Human Services relating to something known as empty beds or bed hold days that would provide support for long-term care facilities when patients have to go to the hospital for treatment for COVID. There's also an ability for out-of-state licensed healthcare professionals or recently retired and inactive Vermont licensed holders to participate in providing services by telehealth. And we've added in something known as the Medical Reserve Corps, which is a reserve corps under our emergency operations of the Health and Human Services. It's a nationwide corps, so it actually helps to identify folks from across the country who might be accessible in the state when we have an emergency over the next, or continue the emergency over the next year. I don't want to go into too much detail, but the other extensions that we see in these sections are the allowance for the director of the Office of Professional Regulation or the executive director of the Board of Medical Practice to act for the board should the boards be unable to meet. And this was particularly important when everyone was isolated at home and unable to meet face to face. That will continue until March of 2022. There's also the authority for the Office of Professional Regulation Director and the Commissioner of Health to issue emergency regulatory orders to protect public health and safety with respect to professional activities and those practitioners under their jurisdiction. Continuing with the concept of telemedicine that we put in place last year and has become so important to the delivery of medicine, where they will continue to allow a waiver of HIPAA-compliant connection requirements for telemedicine equipment, but only to the extent, of course, as allowed under and permitted under federal law. There will be also an informed consent provision that will be reinstated 60 days after the end of the declared state of emergency. There is authority for the Board of Medical Practice to issue temporary licenses for out-of-state providers and to waive certain requirements for physician assistants. This is related to physician assistants. Previously, we were looking at medical doctors. There's also authority for the Department of Financial Regulation to adopt emergency rules regarding health insurance coverage and cost sharing, that would be deductibles and co-pays, for requirements for diagnosis, treatment, and prevention of COVID regarding prescription drug deductible requirements. We do have emergency rules in place now, and these rules, emergency rules have been critically important to folks when they're tested for influenza or they're tested for COVID and tested for other illnesses. And so they wouldn't be charged for those in the diagnostic process for COVID. And that has saved Vermonters significant money. Other states have not had this provision, and we've seen some very high billing that's gone out to patients. Section 4 is the section that begins with the coverage of healthcare services delivered by audio-only telephone. This is a section that came to us as a result of a study that we asked for in Act 140, and the study was completed in December of 2020. The recommendations that were in that study for audio only were taken up by the House Committee on Healthcare because of our work with the House Committee on the entire bill. Our committee worked mostly on provisions that were not related to audio only initially, and the House Committee worked on, took up the recommendations from the report and translated those into legislation that then your Senate Health and Welfare Committee modified during its work and testimony. So the audio-only provision is important, as you well know, especially during this time of COVID. But we have found that treating patients, utilizing a standard of care that is equivalent for services that might be offered in person or by telemedicine through audiovisual, we have found that audio only has a promise for folks. And so there are people who can't make their way to a doctor's office or may be in some way isolated either by weather or transportation. And what we've tried to do in these sections of the bill is to put in place an opportunity to collect data, to learn how best to code for, to charge for, and to reimburse for our audio-only treatment in the state. This section of the bill took our committee a significant time. as we work through some of the issues, and I'll talk about the issue that I think took most of our time. But just simply to say that I can't emphasize how important telemedicine and how important audio only is going to be as we go forward to ensure that we have medically necessary and clinically appropriate treatment for patients when they ask for and can utilize these services. So there are provisions in the bill for relating to audio-only telephone. And one of those provisions that we have identified as critically important for children who may have mental health issues is that there need not be a prior relationship with the patient, that audio only can serve to help folks get into treatment in a way that perhaps they wouldn't if they had to walk into a practitioner's office. There is also a section on relating to healthcare providers and their role in delivering audio-only telephonic services. And it allows for the providers to deliver those services as long as they are clinically appropriate. I won't go into all the conditions, but they are fairly comprehensive, and they are important to providing consistency for audio only. I will also say that as we look at this whole section on audio only and use of telephone, that Vermont is actually pretty well situated as a state within the United States, and I think I could say that we are probably leading the effort in this area, which is terrific, and also in the area of telemedicine. There's also a section on there is another important section relating to inpatient hospitalization, and that is that audio only cannot be used for initializing inpatient hospitalization. Patient consent is required to use audio only, and that would be an agreement that has to be attained before a patient can be treated over the telephone. The biggest area of contention and concern for us in committee was the audio-only medical billing and data collection report section. So as the bill came to us, or the bill, it wasn't a bill, but it was a recommendation that came to us from our House counterparts. There was a provision for parity of payment and reimbursement for audio only across the board. And the Committee on Senate Health and Welfare felt that, and we heard from folks who were concerned about the parity process for audio only being comparable with in-office and audio-visual. And we took testimony from concerned parties and have come to a place we think will be helpful going forward, in that there will be a period of time in 2022, next year, calendar year 2022, when data will be collected about how the telephone is being used between patients and providers. And that data then will be utilized to help inform which codes are used for reimbursement purposes and which conditions should best or could be best treated through the audio-only process. So that information will come back to the legislature in December of 2023, and then from that point on, decisions will be made both in the legislature and with others to determine how best to frame the use of audio-only reimbursement. Then there's also a section on telephone triage services, and so having some rules on health insurance coverage for reimbursement of telephone calls used to to determine whether or not telephone or office services should be used. Those rules will remain in effect until March 31st, 2022. Those are currently in operation. That really concludes the section on audio only, and it actually ends the sections that relate to Act 91 and Act 140. Your Committee on Health and Welfare also heard from folks concerned about people wishing to plan an advance directive. Remember, last fall, I think it was last fall, I have a hard time remembering now, we put in place a provision in statute that would allow for remote witnessing and remote explaining of advanced directives. And so there is a section in the bill that extends the ability to have remote witnesses and remote explainers for advanced directives through June 30th, 2022. And finally, there's a section on the immunization registry information. Currently, the Department of Health does have an immunization registry and keeps records of all immunizations in the state. They can share that information with provider networks, but one of the networks that they haven't shared with because it's not in statute is VHI. So we have added in the Vermont Health Information Exchange to allow for the immunization information to go freely to providers who need access to that. Finally, Madam President, that does end what is in S-117. That's a pretty brief overview of what's in the bill. There's a great deal in there. We also had an amendment that we have put on the calendar for today, and that is an extension for pharmacists to be able to provide COVID testing. And we know that COVID testing is going to go on for a bit longer, certainly longer than March 31st of this year. So we've added in the provision to allow it to go forward until March 31st, 2022. And that was at the request of the Office of Professional Regulation. So, Madam President, that is the bill and the proposal amendment that we had to add. I have a long list of folks who testified. It's a significant list, including the Vermont Health Information Technology Leaders, Vermont Program for Quality Healthcare, MVP, the Board of Medical Practice, the Hospital Association, the Blue Cross and Blue Shield, the Medical Society, Family Physicians of Medical Society, Bi-State Primary Care, Vermont Program for Quality and Healthcare, other representatives of the Medical Society, the Associate Medical Director for the Counseling Services of Addison County, Office of Professional Regulation, the National Association of Social Workers, America's Health Insurance Plans, House Healthcare Committee members, and then our DFR and our rheumatologist from Central Vermont Medical Center. I attenuated the list a little bit by not having all the names, but it is a long list. I would like to say in closing that before we actually started taking testimony on the specific sections of the bill, we heard from many of the people who have been affected by the work that we've done. And we've heard that not just the bill that we have before us, the Act 91 and Act 140, but our practitioners, our long-term care folks, our nursing home providers, our hospitals, our patients, our insurers have been very thankful for the work that we've done in this this body, in the Senate, to help get everyone through COVID the way we have. So, so I'd like to say thank you to you, all of you, for the support that you've given to our committee, and I ask for you to vote positively on this bill. Thank you, Madam President.
Thank you, Senator. We'll first take up the amendment. The question is, shall the bill be amended as recommended by Senator Lyons and others? Are you ready for the question? And if so, please unmute. All those in favor signify by saying aye.
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 Those opposed, nay. The ayes have it, and you've amended the bill. The question now is, shall the bill be read the third time? Are you ready for the question? The senator from Washington is recognized.
Thank you, Madam President. Thank you to the senior senator of Chittenden and her committee for this work. It's an important bill. My only concern of the bill is the timeline, and maybe this is an inappropriate question for the floor at this time. I'm sure the senator from Chittenden is aware there's only 10 legislative days between now and March 31st when some of these, all these things expire. So I was contacted by a constituent that was kind of concerned because some of these things are important for the health care of their families. So I just wondered if rule suspensions are being considered, or just that if the worries of my constituent about the timeline could be assuaged in any way.
Thank you. That's an excellent question, and I think as I have tried to indicate, the House Healthcare Committee is waiting to receive this bill and will act as quickly as possible to move it forward. We believe there should be sufficient time for this to go forward before the March 31st deadline and have it go into law and be signed by the governor. So this is one of the concerns that we've had throughout the debate on the bill and the work on the bill in committee. And we certainly don't want to lose any time in getting it over to the House and then to the governor. But thank you for your question.
The senator from Chittenden is recognized.
Thank you, Madam President. I was looking through subchapter 2 of the bill, and there's some lengthy new language around how telemedicine should be administered and delivered, the opportunity someone might have to talk about their rights and responsibilities around accessing telemedicine. I wonder if the committee, and I'm sorry if I missed this in the discussion, I wonder if the committee took testimony from organizations that serve people who are limited in their English proficiency, and a discussion of how telemedicine is administered in that regard.
Senator, are you asking, Senator, are you asking the reporter, are you asking to interrogate the reporter?
May I interrogate the reporter of the bill?
You may.
Yes, thank you. That was a discussion that occurred in the development of the report, and so as folks go through the data collection process and continue to use audio only, that will continue to be a concern. Let me say that the Department of Health has received, I think it's in the last clump of money. I don't know which money it is, but the Department of Health has received significant resources to reach out and to help folks with English language needs. And so it would seem to me that as we go forward in making our decisions about how to expend some of the federal dollars, this would be an area we might want to more fully consider. So thank you for your question.
Thank you, Madam President.
The senator from Washington is recognized.
Thank you, Madam President. May I inquire of the reporter of the bill?
You may.
Thank you. This may seem a little bit redundant. Maybe I'm hearing something similar than as my colleague has in Washington County. But I really appreciate the work that you've done around audio-only healthcare possibilities. And there's talk in the bill about data gathering and reimbursement rates and whatnot. I just want to be certain that there's no intention or no desire to interrupt audio-only in the meantime, that will continue in the way that it's now being facilitated.
Thank you for that question, Madam President. You're absolutely right. Until the information comes back and we have put in place our reimbursement rates and coding and access to coding for and access to audio only, current provisions will be in place. And thank you.
Thank you. That's important. I've heard from providers who don't have good internet coverage, for example, where they are, and they have to use the telephone in order to do their work because they can't do it over the internet. So I really appreciate that. Thank you very much.
The question now is, shall the bill be read the third time? Are you ready for the question? The senator from Windham is recognized.
Thank you, Madam President. The audio-only option has been a really big win for Vermonters, especially for those Vermonters with mobility issues and our Vermont elders. So I really want to thank the committee for their hard work on S117, because we need to continue to do all we can to make sure people have easy and comfortable access to the healthcare they need. So we all have those folks in our districts, as Senator from Washington, Senator Bellina just mentioned, who do not have internet access. We know that this option of being able to do it over the phone is critical for them. So thank you once again to Health and Welfare for all their hard work. Thank you, Madam President.
Are you ready for the question? The question is, shall the bill be read the third time? If so, please unmute. All those in favor signify by saying aye.
Aye.
Those opposed, nay.
Aye.
Those opposed, nay. The ayes have it, and you've ordered third reading of S117. We have for second reading S78, which was introduced on February 12th, 2021. It was referred to the Committee on Government Operations, which reports it has considered the bill and recommends that the bill ought to pass. Please listen to the second reading.
S78, an act relating to binding interest arbitration for employees of the Vermont judiciary.
The senator from Chittenden, Senator Rahm, is recognized for a report of the Committee on Government Operations.
Thank you, Madam President. S78 would provide that a bargaining impasse between the Vermont judiciary and the representative of a collective bargaining unit may be resolved through binding arbitration upon the request of either party. These changes are identical to changes that the legislature adopted for the executive branch and the Department of State's attorneys and sheriffs in Act 61 of 2019. Additionally, this same legislative language was introduced and passed out of the Senate chamber last biennium as S307 on a voice vote. It was referred to the House on March 12th of last year, and a short time after, the legislature went remote. While I was not a sitting legislator last year, one can imagine that a small bill such as this one simply could not muster the needed attention or urgency amidst a global pandemic to pass. There are 3 sections of the bill, which the majority of the content resides in the first section of the bill. Section 1 amends 3 VSA 1018 on mediation, fact-finding, and last best offer. It makes the final step of the collective bargaining impasse resolution process for the Vermont judiciary identical to the final step of the collective bargaining impasse resolution process for employees of the executive branch and the Department of State's attorneys and sheriffs. That resolution process is as follows. An impasse in collective bargaining negotiations for employees of the judiciary would be resolved by either the Vermont Labor Relations Board, herein referred to as the VLRB, or on the request of either party by arbitration with a neutral arbitrator agreed upon by both parties or chosen by the American Arbitration Association. This section also amends the deadlines for the parties to submit their dispute to the VLRB or arbitrator. It permits the VLRB or arbitrator to select the fact finder's proposal if both parties' last best offers are unreasonable and deemed likely to have a long-lasting negative impact on the collective bargaining relationship. The other aspects of the collective bargaining impasse resolution process will remain the same as under current law. Section 2 repeals 3 VSA 1019, which is the existing arbitration provision under the Judiciary Employees Labor Relations Act. Section 3 is the effective date of July 1st of this year. The committee received testimony from the Vermont State Court Administrator, the Vermont Judiciary's Chief Negotiator, the Vermont State Employees Association, the Vermont Labor Relations Board, and our Legislative Council. Madam President, your Government Operations Committee passed this bill on a vote of 5-0-0 and asks for your support. Though this is my first bill report in this chamber and I'm a little bit rusty, I still remember how to say, I'll get you that answer by third reading. So I welcome your questions. Thank you.
Thank you, Senator. The question is, shall the bill be read the third time? Are you ready for the question? And if so, please unmute. All those in favor signify by saying aye.
Aye.
Those opposed, nay.
Nay.
The ayes appear to have it. The ayes do have it, and you've ordered third reading of S78. We have on the calendar for action S107. There's been a request to pass over it today. Without objection, we'll now pass over S107. We have on the calendar for action S7, which was introduced on January 12th, 2021. It was referred to the Committee on Judiciary, which reports it has considered the bill and recommends that the bill be amended as appears on pages 238 to 252 of today's calendar, and that when so amended, the bill ought to pass. Please listen to the second reading of S7.
S7, an act relating to expanding access to expungement and sealing of criminal history records.
The senator from Caledonia, Senator Benning, is recognized for a report of the Committee on Judiciary.
Thank you, Madam President. Madam President, for those that may not recall what this process is all about, the simple version is to say that way back in 2011, this legislature passed a process by which someone who had been convicted of a crime could have the record of that crime eliminated from their criminal record. And the simple way of thinking about it is if you are now a grandparent, say age 70, and had a conviction back in when you were 18 or 19 years old, you would likely be prohibited from doing something as simple as attending as a chaperone your grandchild's school event. As a result of many states that had passed expungement language throughout the years, Vermont decided in 2011 to enter into that process. I had checked just prior to our entering into a world of COVID how many people had actually taken advantage of this expungement process since this bill was first passed in 2011. And the answer was over 14,000 Vermonters have had their records cleaned since that time period. That was over a year ago when I learned that, and I'm quite sure that that's well over that at this point in time because people really do have a desire, and it's a fairly easy process to go through expungement. And there are now two terms that I'll have to talk about here today, expungement versus sealing. The effect of each is to preserve the record in such a way that you are authorized to say to anybody who asks, have you been convicted of a crime? You can legally say no. In the case of expungement, your record is completely wiped clean. There isn't any record. In the case of sealing, however, your record is set aside and placed in what I'll call a preserved atmosphere that can only be accessed under very stringent conditions. Since the time that this has passed, we've had conversations on a national level on how this process works and what Vermont should do with its statutes. And we have, in fact, had a Sentencing Commission report that was required in October of 2019 to have the Sentencing Commission take a look at a comprehensive assessment of the statutes that govern our expungement and sealing process, and to review the crimes that were eligible for expungement or sealing. We started very small. The process by which the criminal history records are expunged or sealed, the mechanism by which expunged or sealed records are indexed, and the effect of sealing and expungement. The Commission's report set out an expungement and sealing scheme that contemplates most criminal offenses codified in Vermont law based on the current structure of the Vermont statutes. It delineates tiers of severity for criminal offenses, and this bill is a reflection of all of those recommendations that were issued in the report. The bill makes most criminal offenses now eligible for expungement or sealing or both, except for listed crimes and drug trafficking offenses. Listed crimes, if you would think about the worst possible crimes you can think of in Vermont, they are still accepted from this process. Generally, as offense severity increases, access to expungement or sealing decreases. This bill also sets up an automatic expungement process for certain civil offenses in the Judicial Bureau. Madam President, you can find the bill on page 238 of today's calendar. Section 1 makes technical revisions to listed crimes, the definition to account for changed cross-references and updated terminology. Section 2 implements a provision from last year that allows surcharges to be waived by judges for expungement or sealing proceedings if the petitioner demonstrates an inability to pay. For those of you that are unfamiliar, every time you are convicted of an offense in this state, there is presently a judicial surcharge attached to that conviction of $147.50. Section 3 makes changes to definitions in the expungement chapter. The definition of crimes qualifying for expungement or sealing to include any criminal offense except for listed crimes and drug trafficking offenses. It adds a definition of qualifying felony property offense that includes all felony property crimes as identified in the Criminal Code Reclassification Bill from 2020, which was originally labeled H580. It adds a definition of subsequent offense, a term used throughout the expungement and sealing chapter to refer to a crime committed by the person who is petitioning for expungement or sealing that was committed after the crime for which the person seeking expungement or sealing is petitioning. Section 4 talks about expungement and sealing of records, specifically qualifying non-predicate misdemeanors. Just to talk about the word non-predicate, some offenses are what are called predicate offenses. That means that there is some enhancement of the conviction if you were convicted of something that requires enhancement of the second time around. So a bill that has a triggering mechanism of a previous offense would be called a predicate offense for the purpose of this discussion. The bill provides that qualifying non-predicate misdemeanors and regulated drug possession offenses are eligible for expungement 5 years after the person completed their sentence for the crime, or 5 years after completing the sentence for any subsequent offense, whichever is later. It also provides that if the state stipulates to the petition to seal or expunge, the court may grant the petition before the actual eligibility date. Now, Madam President, I want to make clear, before I continue any further, the changes that you hear in this bill are regarding eligibility, not mandating that something should happen. So what I'm talking about right now merely allows a petitioner to become eligible at certain dates that are changed. The qualifying predicate misdemeanors provide that qualifying predicate misdemeanors are eligible for sealing 5 years after sentence completion date or after completion of the sentence for a subsequent offense, whichever is later. The sealed record is expungement eligible 5 years after sealing if the person commits no subsequent offense. If the state stipulates to a petition at any time for expungement or sealing, the court may grant the petition without a hearing. Qualifying felony property offenses and offenses regarding selling, dispensing, or transporting regulated drugs. These offenses are eligible for sealing 8 years from the completion of the sentence or completion of the sentence for a subsequent offense, whichever is later. Once the offense is sealed, it is expungement eligible 8 years after the sealing order if there is no other subsequent offense. If there is a subsequent offense, it would be 8 years after completion of the sentence for any subsequent offense before it becomes eligible. Court can grant a petition to seal these offenses at any time if the state stipulates to the petition. For qualifying felonies are eligible for sealing 10 years after completion of the sentence with no subsequent offense. If there is a subsequent offense, 10 years from the completion of the sentence for that subsequent offense, whichever is later. Qualifying felonies are not eligible for expungement unless the state stipulates to the expungement, and if the state stipulates to a petition to seal at any time, the court may grant it without a hearing. Section 5 talks about the effect of sealing. It clarifies that courts shall make a reasonable effort to notify individuals with sealed records that they may be eligible to expunge their sealed records if they should choose to so petition. Section 6 deals with sealing of records for those 21 years of age and under. Under current law, a youth under 21 shall have their juvenile records sealed 2 years after their final discharge if the youth wasn't convicted of a listed crime and the court is satisfied with their rehabilitation. This section of the bill raises the age to 24 and provides that as long as the person wasn't convicted of a listed crime within 10 years prior to the application to seal and the other criteria are met, they then would become eligible. Section 7 deals with expungement of violation records. This section makes 7 civil offenses eligible for petitionless expungement 2 years after the satisfaction of the judgment. Operating an unregistered vehicle, failing to possess registration, failing to possess a license, operating after suspension, operating without a license, operating without insurance, and operating an uninspected vehicle. It directs the Judicial Bureau to keep a special index of the expunged cases and to destroy all other documents and records subject to an expungement order. Section 8, the Sentencing Commission report. This section directs the Sentencing Commission to consider a policy to make all criminal history records eligible for sealing or expungement, except for the Big 12 offenses, again, those most heinous crimes that you can imagine, and what entities should have access to sealed records, and whether Vermont should employ the existing 2-track system of both sealing and expungement, or whether it should simplify the process into a 1-track system. When we originally established this bill, we set up this 2-track system of A, sealing, or B, actually expunging. There's been an ongoing conversation about whether we should maintain that 2-track system or simply combine it into one event. And in this case, we were looking more towards expungement than actual sealing. This section also tasks the Commission with determining whether and how to implement an automated petitionless process to seal and or expunge. It also directs the Commission to report to the Justice Oversight Committee by November 1 of 2021. Finally, the effective date, the bill would become effective under Section 9 on July 1st, 2021. Madam President, your Senate Judiciary Committee heard from at least a dozen witnesses. I won't read them all now, but I'll summarize by saying we included the Department of Corrections, the folks in probation who would be overseeing some of this process, the victims' rights organizations who were involved in the conversation as well, along with the Attorney General's office, the state's attorney's offices, and the Defender General's offices. We also heard from at least one individual who is actually subject to having her record expunged in the event we are able to pass this legislation. Madam President, the committee vote was 5-0-0, and the committee would ask for the Senate's support. Thank you, Madam President.
Thank you, Senator. The question is, shall the Senate amend the bill as recommended by the Committee on Judiciary? The senator from Addison is recognized.
Thank you, Madam President. May I interrogate the reporter of the bill?
You may.
Thank you, Madam President. I'm just looking for a clarifying answer on the sections about subsequent offenses. I see the language. I'm looking at page 244, but it appears, I think, twice in the bill. There was a distinction in prior law or the current law that between a misdemeanor and a felony offense, and that has been struck, and it's just any offense. So if a subsequent offense doesn't mean the same offense, it just means any offense. Is that correct, Madam President?
That would be correct.
Okay. And then another clarifying question about, you mentioned the fees, 200, you cited the exact fee, but I'm wondering if that is a fee that's paid upon conviction or upon expungement.
It's paid upon conviction.
Okay, so if...
It's $147.50, I believe.
Okay.
Anytime you are convicted of any offense, whether it be disorderly conduct or murder.
Got it. And so the fees would be waived if you haven't already paid it, if you can prove that you are not able to pay. Is that?
That's correct.
Great. All right. Thank you, Madam President.
The question is, shall the bill be amended as recommended by the Committee on Judiciary? Are you ready for the question? So please unmute. All those in favor signify by saying aye.
Aye.
Those opposed, nay. The ayes have it, and you've amended the bill as recommended by the Committee on Judiciary. The question now is, shall the bill be read the third time? Are you ready for the question? So please unmute. All those in favor signify by saying aye.
Aye.
Those opposed, nay. The ayes have it, and you've ordered third reading of S7. We have on the calendar for action S15, which we've received a request to pass over. And so without objection, we'll now pass over S15. This concludes the orders of the day. The senator from Windham is recognized.
Thank you, Madam President. Pending announcements, I move that the Senate stand in adjournment until 9:30 Tuesday, March 16th.
The senator from Windham has moved that subject to any announcements, the Senate do adjourn until Tuesday, March 15 at 9:30. Are there any announcements? The senator from Caledonia, the senior senator, is recognized.
Thank you, Madam President. Senate Appropriations on Friday meets at 1 p.m. I realize it's a short lunch, but please be there at 1. Thank you.
Thank you, Senator. The senator from Caledonia is recognized. Senator Benning.
Thank you, Madam President. Senate institutions will meet at 1 p.m.
Thank you. The senator from Windham is recognized.
Madam President, I'd like to withdraw my earlier motion.
Objection.
Without objection?
At this time, Madam President, I move that the rules be suspended and S117, an act relating to extending healthcare regulatory flexibility during and after the COVID-19 pandemic and to coverage of healthcare services delivered by audio only, be placed in all remaining stages of passage forthwith.
Thank you. The senator from Windham has moved that the rules be suspended and S117 be placed in all remaining stages of passage. Are you ready for the question? Please unmute. All those in favor signify by saying aye.
Aye.
Those opposed, nay. The ayes have it, and you've suspended the rules, and S-117 is placed in all remaining stages of passage. We now have for third reading, S-117, which was ordered presently. Are there any amendments before third reading? Please listen to the third reading of the bill.
S-117, an act relating to extending healthcare regulatory flexibility during and after the COVID-19 pandemic and the coverage of healthcare services delivered by audio-only telephone.
The question now is, shall the bill pass? Are you ready for the question? Please unmute. All those in favor signify by saying aye.
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 Those opposed, nay. The ayes have it, and you've passed S-117. The senator from Wyndham is recognized.
Madam President, at this time, I move that the rules be suspended and that S-117, an act related to extending healthcare regulatory flexibility during and after the COVID-19 pandemic and to coverage of healthcare services delivered to audio only, be messaged to the House forthwith.
The senator from Wyndham has moved that the rules be suspended and S-117 be messaged to the House forthwith. Are you ready for the question? So please unmute. All those in favor signify by saying aye.
Aye.
Those opposed, nay. The ayes have it, and you've suspended the rules and message S-117 to the House forthwith. The senator from Wyndham is recognized.
Thank you, Madam President. This time, I move that pending additional announcements, we adjourn until 9:30 Tuesday, March 16th.
The senator from Wyndham has moved that pending any announcements, the Senate do adjourn until Tuesday, March 15th at 9:30. Are there any announcements? The senator from Windsor, I believe. Senator from Windsor is recognized.
Thank you, Madam President. A year ago tomorrow, March 13th, 2020, we all went home. We all went home until basically today. We have seen each other briefly as we were sworn in, some of us, but basically we have been working remotely since March 13th. So our poor senator from Addison, our Senator Ruth Hardy, celebrated her birthday. It was a tough day last year when she celebrated her birthday. This year when she celebrates tomorrow, there is light at the end of the tunnel. So her birthday has been the bookends in some ways to this pandemic for us. And so I just would ask us all to join together celebrating Senator Hardy's birthday, which brings us light at the end of the tunnel.
Thank you, Senator. And birthday regards to the senator from Addison. Are there any further announcements? The senator from Bennington is recognized.
Thanks, Madam President. Senate Education will meet at 1:30.
The senator from Washington is recognized.
Thank you, Madam President. Senate Finance will meet at 1:30.
Thank you. The senator from Addison is recognized.
Thank you, everyone. Thank you, everyone, for the birthday messages and wishes. I also want to note that it is another senator's birthday tomorrow. I share a birthday with the senator from, I'm blanking on where he's from. I'm in the spotlight and I've forgotten. Senator Westman, where are you? It's your birthday tomorrow, too.
The great senator from Lamoille is also recognized and wished a very happy birthday tomorrow.
Happy birthday, Richie.
The other senator, the Senator Bray, is also recognized, the senator from Addison.
Thank you, Madam President. Members of Senate Natural Resources and Energy, could you please watch for an email and Zoom link for a brief organizational meeting at 1 p.m. Thank you.
Are there any further announcements? The senator from Wyndham has moved the Senate adjourn until Tuesday, March 15 at 9:30. Are you ready for the question? Please unmute. All those in favor signify by saying aye.
Aye.
Those opposed, nay.
Nay.
The ayes appear to have it, and the Senate stands adjourned until Tuesday, March 15th.